Dear students, I am Dr. Kumar, Assistant Professor, Department of Zoology, Government First Grade College of Arts, Science and Commerce, Shira, Tumkur District. The topic of today's lecture is the study of louse-borne diseases, that is human louse-borne diseases. So in that you need to study typhus fever and relapsing fever. So this comes under paper 4, that is insect vectors and diseases, BSc 4th semester Zoology, Tumkur University. Study of human louse-borne diseases. In that, so in this lecture we shall see these two diseases, that is typhus fever and relapsing fever. The first is epidemic relapsing fever. The epidemic relapsing fever is a louse-borne infection caused by the bacteria, spirochete bacteria called as Borrelia recurrentis. So this epidemic typhus and the relapsing fever, both the diseases, they predominantly affects the population living in the poor hygienic conditions. Poor hygienic condition here refers to the people who are living in the slum areas and the hygiene is very less. Hygiene is very less. So there this kind of epidemic typhus fever as well as the relapsing fever frequently appears, where the body louse infestations are prevalent. So body louse infestation, body says the body lice is responsible for causing both the epidemic typhus as well as the relapsing fever. Since hygiene is not maintained in these people, those who are living in the slum areas where the environmental quality is less and the house also the cleanliness is not maintained. Okay, so in that area the infestations is more, and in the clothes the infestation of the body lice is more. So this is our the pathogenic bacteria, that is Borrelia recurrentis, which causes epidemic typhus. This is our vector, that is human body lice. Human body lice is responsible for spreading or for transmitting the pathogenic agent, that is Borrelia recurrentis, from one person to another person during blood meal. As far as the transmission of this epidemic typhus is concerned, humans constitute the only known reservoir and host of Borrelia recurrentis. So the only host for the human body lice is the human beings. Okay, so for this reason the humans are considered as reservoirs. After becoming infected by ingesting an infected blood meal, okay, a louse remains infected throughout its lifetime. This is an important aspect. Okay, so once this louse becomes infected with the pathogen, that is Borrelia recurrentis, once the Borrelia recurrentis bacteria enters into the body of the louse, this infected body lice can able to transmit the pathogen from one person to another person throughout its lifetime. The modes of Borrelia recurrentis transmission are similar to that of Rickettsia prowazekii. The transmission is similar. The transmission of the diseases is similar to that of the Rickettsia prowazekii. Yes, however, This Borrelia recurrentis is able to penetrate and infect the intact mucosa and skin surfaces. Since they feed on the blood meal, especially they are the ectoparasites, so they only cause skin irritation and the intact mucosa, that is the below the skin subcutaneous layer will be infected while piercing its mouth parts into the skin to draw the blood meal. The symptoms of the epidermis typhus is the illness begins abruptly, that is suddenly. Okay, the illness begins abruptly with a high grade of fever, pain, heavy body pain, anorexia, that is loss of appetite. ಹೊಟ್ಟೆ ಹಸಿತಾ ಇರುತ್ತೆ, ನಿಮ್ಗೆ ಊಟ ಮಾಡೋಕ್ಕೆ ಹೋದರೆ ಊಟ ಸೇರೋದಿಲ್ಲ, that is what is called as loss of appetite. Dry cough, fatigue, that is general tiredness, skin and mucosal hemorrhaging, that is blood bleeding, neurological, liver and renal involvement, that is nervous system, liver and kidneys are not functioning properly, and splenic rupture. The spleen is also infected and infection is followed by the inflammation. There are different diagnostic methods are operating. The jaundice is a diagnostic clue that suggests the relapsing fever among the louse-borne diseases. So if the people are getting the jaundice, one of the chances is that it is a relapsing fever caused by the pathogen through the bite of what is called as human body lice. The common diagnostic methods includes the detection of Borrelia recurrentis. So in the blood, that is usually when the blood is stained with the Giemsa stained blood films. Okay, when the blood is subjected to Giemsa, so this the Borrelia recurrentis can be identified and recognized under the microscope. Another method of diagnosing is the assay, which is carried out by a machine. So that is what is called as polymerase chain reaction assays procedure. That will be done in the diagnostics. And as far as the treatment is concerned, treatment of epidemic typhus is based on the administration of the antibiotic drugs that includes tetracycline and chloramphenicol. So in outbreak situation, where the outbreak occurs in the community level where it becomes prevalent, okay, so they both the antibiotics like tetracycline and chloramphenicol are usually advised by the doctors. A single 200 mg oral dose of doxycycline can also be found to be very effective in order to kill the bacteria present in the bloodstream. So that is about the relapsing fever. The next is typhus fever. Typhus fever. So typhus, also known as typhus fever, it is a group of infectious diseases that includes 3 different types of typhus, that is epidemic typhus, scrub typhus and murine typhus. The common symptoms include fever, headache and rashes appears on the body. Typically these begin 1 to 2 weeks after exposure to this biting. This epidemic typhus is caused by Rickettsia prowazekii. Here the disease causing agent is Rickettsia prowazekii, whereas in the relapsing fever it is Borrelia recurrentis. Okay, in the epidemic typhus it is caused by a bacteria Rickettsia prowazekii and obligate intracellular bacterium. It's an obligate intracellular bacterium. It is not ectoparasite, it is endoparasite. It is present inside the cells. Okay, it is an obligate intracellular bacterium. The mortality rate of this epidemic typhus varies from 0.7% to 60% for untreated cases. Okay, if untreated, the people will die. Okay, so the mortality percentage ranges from 0.7% to 60%. The lice becomes infected with Rickettsia prowazekii when they feed on the bacteremic individuals. However, the lice die within 1 week after become infected. Whereas the relapsing fever, that is Borrelia recurrens, okay, the infected lice will not die within 1 week. It will be there for some more time. Okay, but here the lifespan is decreased about only 1 week after the infection of the Rickettsia prowazekii. The lice will die, and the lice becomes infected, and after the infection of 1 week, the body lice will die. As I told you, there are 3 types of typhus. The first one is epidemic typhus caused by the bacterial infection, that is Rickettsia prowazekii. The vector is body lice again. So this is our case now. These two are not concerned, but for your information, so these are the 2 different types. The vectors are different. Okay, they are also the typhus only, but vectors are not body lice. One is chiggers, the other is fleas. Okay, so the disease causing agent is also quite different. That is scrub typhus is caused by Orientia sugumushi. Okay, where the vector is chiggers, and murine typhus is caused by the another species of Rickettsia typhi. So this is usually spreaded by the vector fleas, the category of fleas. But the concern is epidemic typhus. So this is due to the bacterial infection, that is Rickettsia prowazekii, spreaded by the human body lice. So this is Rickettsia prowazekii. The symptoms of this typhus, epidemic typhus, so that is a sudden onset of fever. Once the bacteria enters into the body, so the symptoms appears in the body, that is sudden onset of fever, chills, headache, flu-like symptoms, rashes appears in the trunk region and spreads to the extremities. First it appears in the trunk region, and it again gradually spreads to upper and lower extremities. Muscles and joint pains, joint aches, and nausea. So these are the symptoms of the epidemic typhus. Look at this. So this slide shows how the rashes appears on the body when the person is infected by Rickettsia prowazekii, and the bacteria is Rickettsia prowazekii, and the vector is our body lice. Treatment measures involves we are all in the era of antibiotic. A wide spectrum of antibiotics are available in the drug stores. So doxycycline or chloramphenicol is given as a general antibiotic in order to kill the bacteria, that is Rickettsia prowazekii. Sometimes patients may need more of oxygen. Okay, and the doctors will advise some antibiotic injections are given through intravenously. So this is all about the louse-borne diseases. In that you have to study. There are 5 diseases you need to study. Among these 5, in this class only the 2 we have discussed, that is relapsing fever and epidemic typhus. Okay, the rest three we will discuss in the next videos. So these are the reference materials along with the link. Dear students, this is the time of COVID-19 pandemic. The second wave is operating. Take maximum precautions. Don't go outside. Even if you go outside, wash your hands very frequently using soap and sanitizers. Cover the face with face covering or face mask. Maintain the individual distance. Okay, social distancing of minimum 2 meters between the individuals. Stay home, stay safe, save lives. Thank you.